I'm going to start with introductions. For those of you who don't know me already, my name's Pritt Kallah, and I'm the primary care facilitator for Waltham Forest. And my colleague next to me here is Faye, who hopefully all of you are aware of. We always get asked if we're going to send the presentation slides, so I'm going to preempt that question and let you know that yes, we will. We'll also send you any frequently asked questions that come out of the webinar today as well. We will be sending you a feedback form too, and I would really appreciate it if you could fill that out and send it back to us, because it does help inform future sessions. So any useful tips that you might have for us or anything really, just let us know. There will be a section at the end of there will be a time to raise questions at the end of each section, but please, you can add it to the chat too, and we'll do our best to monitor both. So what we've got here is the agenda for today. We're going to show you an overview of the Waltham Forest IBC services contract. We're going to do a recap of the public health services searches too. Then we're going to spend a little bit of time talking about data accreditation improvement incentive scheme, which some of you will already be aware of. And then we're going to spend some time letting you know how CEG is supporting you to complete your contracts. So just to start with, for the ICB contract, there's no change to these specifications, and that's CKD, high risk asthma and COPD, and the SMI physical health check. Just wanted to point out to you about the APL renal tool. This actually supersedes the falling EGFR trigger tool that you may be familiar with. So if any of your clinicians want to do some more intensive renal work, CKD patients, this is how you can request the tool. And if you need any support, obviously just let us know. So in the LTC, we have some minor changes, and we can confirm that for asthma now, you no longer need to do the RCP questions, and depression screening is no longer required. And for COPD as well, the MRC assessment and depression screening no longer required. So end of life, this is a new specification. What practices need to do is use the early identification tool. Now, this is a tool that's available both in EMIS and System 1. It's not something that's been produced by CEG, so please don't confuse it with any of our Apple tools. We've been asked to host it for practices to use. You need to run the tool every quarter, and that will bring up a list of patients who are within the last year of life. Now, that list needs to be reviewed by a clinician. If you agree that the patient is on their last year of life, then you need to code them appropriately. Now, the coding for this will not be in the tool itself. You will need to code them in the problem page. If there's any patients who the clinician does not agree is in the last year of life, you can code them as palliative care not currently clinically indicated. If you need help with that, we do have the search for that. You can find the code for that, the SNOMED code in the search, or you can just contact us and we can let you know. Once you have a patient on the palliative care list, you must offer them personalised care and support some discussions with them. This will then enable you to create a care plan for the patients. Creating the care plan, practices will get paid £200. And then obviously once that's there, you can review the care plans, but you mustn't review them more than 7 days of creating them. If you've created care plans prior to the 1st of April, then you'll also get paid for reviewing those. So what I'm saying is, if you've created them last year and you're reviewing them this year, you'll get paid for reviewing them, obviously not for creating them, because it's not from the 1st of April. Hope that's clear. Payment will be based on the Better platform, so you will be recording the care plans on there, but you must also use our template, because we will be providing a dashboard and the ICB will be using that to reconcile payments. This tool is based on the gold standard framework for proactive identification guidance and supportive palliative care indicators. Okay. High intensity users, this is again another new specification from this year. Practices are being asked to proactively manage patients who frequently attend A&E. You must Collaborate with your PCN to deliver outcomes of the scheme. So that could be use of care coordinators, social prescribers, health and wellbeing coaches. And what you need to do is have a holistic approach to see why it might be that patients are turning up at A&E. Sorry, at this point, can I just highlight that you're only really going to be monitoring those who are attending A&E inappropriately. So you will need to review those discharge summaries to decide whether it was an appropriate or inappropriate attendance. And then you'll need to manage those patients. This is hopefully to reduce unavoidable A&E attendances. So please do use your care coordinators, your social prescribers, your health and wellbeing coaches. Look if you can provide telephone triage, same-day appointments, and whether any self-management is indicated too. Identify the best practice in the network, and share best practice too. So if somebody's doing better than others, then in your meetings discuss what you're doing. And as I said, a variety of methods to support the patients. Next, we have wound care and suture removal. Now, this is to ensure a 5-day wound care service for adults and children. So you have to ensure that there are sufficient appointments available to all the registered patients within a PCN area. And this is for adults and children, as I said. If a practice wants to provide this service independently of the PCN, again, they would need to make sure that they have a 5-day service and that there are sufficient appointments for their registered patient list. Please ensure that clinically appropriate patients are treated in an appropriate primary care setting, which enables continuity of care and consistent review. Practices will be paid a payment of 15 minutes nursing time per procedure. So if a patient turned up and had more than one procedure, so say they had a wound dressing, the wound was cleaned, it was, and anything else was done, each of those would be a procedure. This is just a screenshot showing what kind of procedures are included. I won't go over them all, except to say that all burns related to children 0 to 16 years, they should be referred to the urgent treatment centre. Okay, we've got childhood immunisations. This is again another new specification, and it actually builds upon COF achievement. So as you're aware, with COF, it's children up to 2 years and 364 days, and then children up to 5 years and 364 days. There's 2 bands. There's a band A is looking at the baseline as at the 1st of April with an increase of 10%, or if you go to the maximum of 96%, there will be a £1 per weighted patient payment. For band B, if you are taking your baseline from the 1st of April, if you increase that by 5%, there'll be 50 pence per weighted patient payment. And as it says here, if the national target of 96% is achieved at year end, a further £1 per weighted patient will be payable. So all in all, that will be £2 per weighted patient in total. So for this specification, they are looking to include patients that have declined. However, I lost my place. We are in discussions with ICB to agree the most appropriate use of the child IMS coordinator's time. So we will get back to you with more information on that. And apologies that it's not ready yet, but it is actually with the ICB at the moment to agree the pathway. Now, we're requesting practices to use our Apple Childhood Immunisations tool because this will help you filter and identify your declined and contraindicated patients. You can see just at the bottom here, there is a little filter that you can tick, and that will give you a list of your declined and contraindication patients for you to go through. The final new service we have is the Tea Today programme. Now, this is an extended consultation for patients who have early onset type 2 diabetes. because they are at higher risk of complications than if they develop this later in life. And as it says, it's aged between 18 to 39 years. So what you must ensure you do, make sure the classification of diabetes type is recorded. And again, you can't do this on the template itself. So if you record that in the consultation or as a problem, you need to ensure that preconception advice is given, because obviously the women in this age group are of childbearing age. And there is a higher mortality rate amongst them. Clinicians need to ensure optimization of glycemia, cardiovascular risk and weight, as well as make an assessment of their well-being and social needs. You also need to complete depression screening. And if any of the 9 care processes are missing, there's also an expectation that those are mopped up too during this 30-minute consultation. You can find this section on your LTC templates, and it'll be the very first section of the template. And practices will receive £52 per consultation. Any questions so far? We're going to unmute you, so give us a few moments.
Helene, you've got your hand up.
Hi, I wanted to ask, for the IMS coordinator to pass on the details of the patients that are declining, do we need to obtain consent to pass that information along? I don't know what info they actually need, like their contact details.
So we are currently having dialogue with the ICB at the moment to clarify all of this. As obviously, it doesn't state it in the specification, and we need to make sure that the IMS coordinator's time is being used legitimately. So we will, as soon as we have clarification on whether there needs to be consent,
signed dissent,
then we will let everyone know. We are working on a pathway that will make it very clear as to what the requirements are.
Yeah, hopefully we'll do that in a flow chart so you can just follow it rather than have lots of wordy documents.
Okay, thank you.
Yeah, sorry we couldn't help you right now.
Rashna?
Hi, Faye. Hi, Pritt.
Hi.
Yes, hi. Yes, quickly wanted to ask about, I think I did message as well, but it's existing end-of-life patients, the third search, how the payment's going to work for those? Do practice get paid for those, or aspects only are mentioning for 2, the new ones and the review ones? But
okay. So
over the third search that has been added for 1.2 now, yes.
Yeah. So basically, any patients who had a care plan created prior to the 1st of April this year, obviously you won't get paid for the creation of it because it was before the specification was launched. But if you are reviewing those patients, you'll get paid the review fee, which will be £100.
Okay, so all the patients who were palliative beforehand, like some practices have more than 80 patients. So they will be paid for review, all of them, yeah?
Yeah. So if the care plan was created before the 1st of April, but reviewed, you'll be paid only the review. If they created after the 1st of April, then you get paid for the creation of it, and also the payment, the review. But the review has to be 7 days or more after it's been created. So you can't create it and review it in the same week, basically. I mean, you can, but you won't be paid for it.
Okay, that's fine. Okay, so I just want to make sure that we just practices do get paid for the third.
Yes, they will. That's been confirmed by ICB.
Thank you. Thank you.
Okay, I'm going to do a quick recap on your public health services. You need to provide NHS health checks for patients. It's one health check every 5 years. So if you unfortunately do a health check on a patient more than this, you'll only be paid for one. Make sure that you recorded ethnicity, BMI, BP, Q risk, whether it's Q risk 2 or 3, and their smoking status. Then we have sexual health and LARC. So for sexual health, we have STI screenings, and there's 3 age bands. So there's those that are under the age of 15, those who are 15 to 24, and patients who are over 24. If you found between the ages of 15 to 24, if there's a positive chlamydia, you need to make sure that there's partner notification and follow-up, and also that could mean referral onwards. There's also other STIs, which would include gonorrhea, syphilis, HIV, and hepatitis B screening. And that takes us on to hepatitis B screening. This is for patients aged over 12 years, and practices will be paid for all the doses, including the post-vaccination test. And then we have LARC, and this is for coil and implant insertion and removal, and or removal. I mean, it's not, yeah, you have to do both in the same appointment. But please do make sure that you use our public health invoicing tool to invoice for the services you've performed. And any questions on that? It's not working, sorry. But the next slide is any questions. So I'll stop sharing, just check if there's anybody there with their hands up. No, that looks brilliant. Okay. To speak about the data accreditation and improvement incentive scheme. I know most of the practices I've visited, we've discussed this, so hopefully you should be at least aware of it. But this has been jointly commissioned between the CEG and now ICB to support practices with recording good quality data. And there's two areas to focus on. The first one is consultation types and job roles, and the second area is the wider determinants of health. So looking at the next screen, we'll go into a bit more detail. There's 3 phases in this scheme. For phase 1, practices need to sign up to Edenbridge ABEX. They need to provide evidence of updated consultation types. So what that means is there is a sort of a recommended list that you should be using. And when you've updated the list according, we have a fact file that practices can use to support them in this. And once you've made sure that the consultation types are, with the recommended ones, you need to submit the evidence to us to ensure that we can approve that for payment. And that's similar with staff job roles as well. There's a recommended list, and so long as you've got the list and you maintain that, we can evidence that for payment. And so far, we've had 16 practices that have been able to submit invoices for this already. So we're looking to see that, at least 100% if we can, uptake on this. Once phase 1 has been completed, we'll move on to phase 2. You've got 2 parts to this. So the first part, practices need to record ethnicity, language, communication and contact preference, and carer status. Now you can see it says 95 to 100%, and this is because most of this should already be, collated for patients. With regards to carer status, we're asking practices to care as they feel appropriate. And when we come to phase 3 of that and come to visit the practices, we'll just ask you what it is you're doing to record this. Then for part 2, we have social isolation, health literacy vulnerability, housing vulnerability, and income vulnerability. Now, these are for 2 specific groups. It's patients who are deemed to be living in deprivation, and also patients who are newly registered from the 1st of October last year, so that's 2023. We have support searches for you that you can use, and that will tell you the patients that you need to target, and also how you're doing with percentage-wise. Now, it's a tiered payment, so obviously you can do the minimum, 25%, but the more you achieve, the more payment you will get. And again, I'm not going to go through the payment right here, but if you want more information, please do just drop me an email and we can talk through this. And then the final phase, which will be the accreditation visit at the end of year 2. And we are now currently in year 2. So if you're not signed up already, please, and you want to, please make sure that you contact us as soon as possible. We are providing dashboards for practices so that they're aware of their achievement. And we're also checking those dashboards. So once we see that practices have achieved the minimum 25% on part 2 of phase 2, we will start contacting you to put these visits in place. And we will be checking to see that you've got all these system requirements in place, and more about the maintenance of it. It's all well and good to say, yes, we've done it now, but then, you might slip into the old habits. So just make sure that this is maintained and that all required training has been done too. And would like to see what the plan would be for new staff that are joining as well, to make sure it's part of their induction process. So for the wide determinants of health, we have provided a page in each of these templates. So it's very easily accessible. So when you come across it, if you're in any of these templates and you notice that the information is missing, please do start completing that, and that will help you achieve your percentages. Any questions? Kiran?
Hi, can you hear me?
Yes.
Hi. I'll be honest, I have a few questions because it's the first time King said he's going to be doing this. They've not done it before.
Okay.
So I was just going to say, do you think would you prefer if I email you the questions or
Yes. Email
email
me,
you
and if
the
you
questions,
prefer,
yeah?
we can do a Teams meeting, or
Yeah, please,
whichever way you want to be
because I'll
supported.
be taking care of this, so I just need to wrap my head around it all.
No problems.
All right,
No
thank
problems.
you
Thank you,
all.
Kiran.
Any more questions around data accreditation?
I think you still got your hand up. Oh, brilliant. Put your hand down, Kiran. Oh, is there another question? All right, then we're going to move on.
Just to reiterate what Pritt said, if you haven't signed up to the spec or you're not sure if your practice has, do contact us and we can direct you in the right place to sign up. For phase one, where it's all around the consultation types and job roles, this will become a national standard soon, so you will be ahead of the game if you are taking part in this now.
Yeah. All right, let's move on to what we can do to support practices. We have a wide variety of ways we can support you. There's some Apple tools available. So hopefully you're all aware of these. We have Apple IMS tool, which allows practices to view children with incomplete or overdue set of immunizations, and that can help you improve your call and recall processes. We have a cancer diagnosis audit tool, which allows practices to review their processes around suspected cancers, cancer referrals rather, which could lead to confirmed diagnosis. There's the Apple NDPP tool, which is the National Diabetes Prevention Program, and you can easily view a list of eligible patients for referral to the NDPP program who are at risk of diabetes. And then we have the Apple AF tool, which can help clinicians review AF patients to ensure they're on the safest and most effective medication. We've also provided links here that you can request any of these tools if you wish to. Hopefully, again, you're all familiar with our suite of searches. This is just to highlight the suite and where each of these that we talked about today can be found. So you've got your ICB contract, which has got your CKD, end of life, high density users, etc. searches in there. You've got your public health folder, which supports your NHS health checks, your sexual health and LARC, and also that's where we'll be hosting the public health invoicing tool on a quarterly basis. And then you've got your PCN contracts, which is for your care home supplementary service, the IIF, and also your structured medication reviews searches. That was for EMIS, and this is for System 1 practices, just a screenshot there for you. So when we send the presentation slides out to you, if you need to be reminded where things are, you have the slides to hand. So all of the specs that we've just talked about, these are the templates that support them in some way or other. Please make sure that you're using these templates. Please also make sure that you've activated the F12 protocol, which launches these templates. Now, the benefit of that protocol is that you will get the most recent up-to-date version of the template. I'm sure you're aware that there's an EMIS bug, where if you select templates from your recently used drop-down, sometimes you could be picking up older templates. So this is kind of to make sure that you're only using the latest versions. And again, if you need support with this protocol, we're here, so just drop us a line. And again, we can do that by Teams, or when we're on a practice visit, we can show you how to do that. We have a range of dashboards. These are password protected because they're not available for everyone to use. They're only Nel-wide. If you have accessed them before, you'll see the screenshot on the left shows your Waltham Forest landing page. So examples of templates, dashboards rather. You've got your asthma, the COPD, the TCSNS is there too. And then the other screenshots are just showing you you know, what some of these dashboards look like when you open them up. And that's me flying in to support you. If you need well, actually, you're all entitled to a practice visit, so please do take up the offer. If you have a burning desire to have a visit, please just drop us a line and we can fit them in. We're starting to take bookings now. So it's first come, first served. And then as the diary starts getting booked up, it does tend to get a little bit busier and it's not always easy to get your first choice. So I would say drop me an email and we will do our best to find a mutually convenient time that I can come down to you and support you. These practice visits are tailor-made. So also please let us know what you might be struggling with so that we can support you in that, and then anything else that crops up at the visit. And also they can be in person or virtual, I should have said. Hopefully you're all receiving our e-bulletin as well. So this is the one from last week. Hope if you are receiving them that you find them useful. So please do let us know if there's anything more we can do. We've got the URL there as well. If you wanted to sign up for it, if you're not already on it, it will take you to a form. Fill the form in and that will then include you onto the mailing list for future bulletins. We're beginning to support PCNs now as well. So what we've started to do is send out data sharing agreements to PCNs, which will enable them to access our templates and documents. And we have continuous dialogue between us and the PCNs too. Now, this is a busy screen, but basically what it is some resources that you might find useful. Or if you wanted to, you could just put your phone against the QR code there and visit our website and just have a little stroll around to see what is there. We've also provided a link to the new Waltham Forest webinar that we did in April. There was quite some very good questions come out of that. So if you wanted to review the questions, obviously you can access that document and see if any questions you have have already been answered. But again, if you don't want to do that, you can just email us with any questions. And a reminder of how you can find us. So I'm Pritt Kallah, and that's my email address there. And then Faye and her email address as well.
And just a reminder that we have got a co-op webinar that you're entitled to sign up to. The link went in the bulletin today. And the webinar is on the 24th of July. So do sign up for that as well, because that'll give you all your co-op updates.
Yeah, and that is now wide as well. So should have a good turnout.
Okay, thank you very much.
Thanks, Faye and
you.
Pritt. Take care.
Thank you.
Thank you, you too.
Bye-bye.